hello, hello. Welcome again into 1017 FM and 710 KEEL. Welcome into another edition of Strategies for Living. I'm marriage and family therapist David McMillan, way down yonder at the other end of the broadcast table. Yeah, you're not grinning like a Chessy cat today.
Well, I'm grinning like a tired
tired like a
therapist
tired
today.
therapist today. PLPC Carla McCormick. Have we put you through the ringer today?
I had a busy day.
Manic Monday?
A little
I guess
bit.
we should. I guess I should not say Manic Monday to a psychotherapist, should I?
It conjures up all
Yeah,
kinds of
I
anxiety.
probably don't want to go there. But I may have some help for you. Also, our ace producer, he keeps us flying high, low, and in between. The ace of the airways, Ruben Wright.
Good evening. Good evening.
You
Just
look
keeping us out
rested.
of the mountains.
You
I got a nap today.
Yeah, you got a nap today. So you're off the morning, the double duty.
Right. Yeah.
Okay.
I still come in to do traffic, but it's not at 3 o'clock in the morning.
That's insane. Insane.
Sick is what it is.
Yeah, it's welcome to radio. Let me ask both of you, what do you know about acupuncture?
Not much.
And not a whole lot over here. I know people who have had it done, and I know people who swear by it, but I don't know enough about it.
Well, you know what? I think there's probably a lot of us that don't know as much as we ought to know about it, and we're going to try to correct that today, begin to try to correct that. Our life strategist is Meredith Stewart, who is at Acupuncture Shreveport. We'll find out all about acupuncture, about Meredith, about Acupuncture Shreveport, and much more here on Strategies for Living. Folks, thank you for tuning in today. We are brought to you by CADA, the Council on Alcoholism and Drug Abuse of Northwest Louisiana. They've been helping individuals and families for 60 years. We're also brought to you by Milestones Counseling Center, by Jerry Anderson State Farm Insurance, by Learning RX, by Highland Place Rehab and Nursing Center, by Resilient House, and by Jacob's Well. Inspirational books and gifts. Quick break, and then back to meet Meredith Stewart right here on Strategies.
And the slow parade of fears without pride. Now I want to understand.
Welcome back into Strategies for Living, 1017 FM and 710 KEEL. Marriage and family therapist David McMillan along with PLPC Carla McCormick. Let's welcome to Strategies our life strategist this evening. She is a nationally certified acupuncturist and herbalist, licensed to practice in Louisiana. She's got a master's degree in acupuncture and oriental medicine from the renowned AOMA Graduate School of Integrative Medicine in Austin, Texas. That was after receiving a BS degree in biophysics from Centenary College. She also studied at Chengdu University. I hope I said that right. In China at MD Anderson Cancer Center in Houston, and lots of continuing education courses. Welcome, Meredith Stewart, to Strategies for Living. Mrs. Stewart, welcome.
Thank you so much for having me. I'm glad to be here.
Thank you for coming. And I know you have a busy schedule. We've never met before this evening, other than by phone, but we've shared many clients who have said so many good things about you.
Oh,
Yeah.
thank you.
Yeah. So I feel like I know you, even though we're only meeting for the first time this evening. Let's start with let's just kind of call this evening Acupuncture 101. I hope this won't be the only time you come and join Carla and Ruben and I, because this is something I think we need to know. But let's start with the obvious question. Many people will know exactly what acupuncture is, and some won't. What is it? What is acupuncture?
Acupuncture, I think most people have the idea, they know that acupuncture means insertion of needles into the body.
Yeah, some people go, "Eek," when you say that.
And it's hard to imagine that somebody's going to, we have to say, they're going to stick you with needles and it's going to be pleasant. It's just impossible to imagine until you try it.
Yeah.
These needles are so fine and thin.
Like a hair.
And the places they go on the body, I mean, we don't put them in the fingertips, for example. The places they go are comfortable.
Right.
It's really a relaxing, pleasant experience.
That's wonderful. How long has it been around?
We think at least 5,000 years.
Wow. So this goes back to China then.
Well, a lot of the origins are in China. There are textbooks 2,000 years old from China that are still used today. But it's interesting. There's a man found frozen in the Alps in Europe 5,000 years ago.
Yeah.
He was perfectly preserved, and he had tattoos, little tattoos all on acupuncture points on the body.
Oh, wow.
And they analyzed his body and found that he had bad arthritis in his back, and the same points that we would use today for back pain, they knew about those points in Europe. That's why I say 5,000 years ago.
Right.
They were stimulating the same pressure points, the same pathways in the body to relieve pain.
How does? Is there an easy way to explain how it works? I mean, I know it. We're working with the energy system. We're working with the flow of energy in the body, right?
My understanding has everything to do with the fascia in the body. So most of our body is made of fascia. We have everything besides the bones and the muscles and the organs is a type of connective tissue called fascia. That's where fat is stored. And the acupuncture channels are found in the fascia. So the fascia is organized in lines that go from the hands or the feet to the torso. And the signal is carried through those lines. So if I insert a needle on your hand near your first finger, a signal is going to travel up your arm and up the side of your neck to your nose, for example. And by relaxing that fascia then, blood can flow better and nerve signals can flow better. The fascia is wrapping the nerves and the blood vessels. And when we can relax that, blood flow is improved.
So we're talking about addressing inflammation then in the body.
Absolutely.
And we'd be talking about arthritis. We'd be talking about anything like tendonitis or bursitis or gastritis or any of those other itises.
Correct.
Yeah. So is there anything that how would I know, Meredith, if I'm a candidate for acupuncture?
I would say any type of pain that somebody has, if it's related to soft tissue, so if it's related to muscles, blood flow, vessel problems, pinched nerves, most types of pain. The only thing I say that we really are not going to be able to touch with acupuncture is a real structural problem. Somebody's got a screw loose that's had their hardware somewhere in their knee
body,
or their back, and the
the
screw's backing out.
right.
Acupuncture's not going to do that. It's
Right.
got to work with your natural system.
Right.
But our body should heal when we're injured.
And that's the whole idea, right? It's like the whole idea is to enhance the natural healing ability that the miraculous body as a system has. Have I got that right?
Absolutely.
Okay.
The body should heal. If it's not, why not? Maybe it's not.
So would it be fair to say then that acupuncture helps the body get out of its own way?
Yeah, that's a great
Yeah.
way to put it.
Okay. Because sometimes there are blocks that, maybe some of it comes with just our lifestyle today, the way we live our lives today.
Emotions and stress, we know they cause you to tense up somewhere.
Yeah.
A lack of movement.
Yeah. So, anything then, migraine headaches,
Yes, treat them all the time.
restless leg syndrome?
Yes, sir. Now that one, we're going to have to start getting into herbs as well. So
Ooh.
this is...
Now, so you do, and I mentioned that you're an herbalist also.
Yes, sir. So really I consider myself to practice traditional Chinese medicine. And so there are 5 components of that, which are acupuncture, herbal medicine, nutrition, massage, and something called qigong, which I always explain that's kind of like Chinese yoga. Okay, it's it's a blanket term for a lot of different kind of movement and breathing exercises. So those are considered the 5 branches of Chinese medicine. You put them all together, you're going to get the best results.
Wow.
Meredith, I have a question. So obviously in college you studied biochemistry. My guess is you probably thought you were going to go to medical school.
That's right.
And so at what point did you say, I don't want to go to medical school, I'm going to take this course instead of the course you were on? What turned you on to non-traditional or Chinese medicine?
Really, for me, I value gentleness very highly. And so in thinking about what I always wanted to be a doctor all my life. But when it came down to it, studying for the MCAT, I said, maybe I'll do massage or nutrition. I wanted to do something very gentle and definitely very respectful to the body. And I Googled acupuncture, and I saw that they taught all those things I just mentioned in one program, that you could study acupuncture, massage, herbal medicine all together in a 4-year program. And I said, that's it. That sounds fascinating.
So is that considered homeopathic? I mean,
No, no, I wouldn't say that.
Okay, what's the difference? So as a layperson, because when you say herbs and nutrition and everything, that's where my mind goes. So educate us on the difference, or
Okay.
educate me.
So homeopathy means you're using a treatment the same as the pathogen. For example, you get bitten by a snake, and a homeopathic remedy for that involves taking that same snake venom in a microscopic amount.
Beyond minuscule.
It's a different philosophy of
You're diluting and diluting and diluting and diluting and diluting and then diluting more.
correct.
Yeah.
So for me and the herbal medicine I practice, we're really taking the plants, the roots, the leaves, the barks, the whole herbs, and generally they're made into a tea and
Making
and drunk.
medicine out of them.
Correct. And these days they process the herbs to be in pills or tablets or liquid form.
So would a person who is just doesn't have any really major aches and pains, just the aging thing, a stiff back, stiff knees, maybe some arthritis in their hands, could that kind of person benefit for what you guys are doing? Does it have to be somebody who's really, really sick?
Oh, it brings up a good point that this is a complete system of medicine. It was, you know, it was the complete system of medicine for a large culture of the world for thousands of years. So it's not just for pain. And I'd like to, you know, I'd like for people to know that, because a lot of people realize it's for pain, but they don't, they wouldn't think of it for a liver problem, for example.
Yeah, yeah.
But helping blood flow to the liver is extremely important when there's toxic buildup, there's cirrhosis. In fact, I've had several patients whose doctors have been, you know, pleasantly shocked at how well they can heal, because they're not used to seeing it. They have an expectation you can only heal this far from this disorder, but they haven't seen what acupuncture can do. It's just so new in our part of the world.
Right, right. Wow. This is exciting stuff. Meredith Stewart, acupuncturist and Chinese herbal medicine, is our life strategist this evening. We are learning about acupuncture. Her practice is Acupuncture Shreveport. We'll come back and tell you how you can get a hold of her. And we'll also talk about some hormones and neurochemicals. We always need to talk about hormones, don't we? Welcome back into 101.7 FM and 710 KEEL. Welcome back into Strategies for Living. PLPC Carla McCormick, marriage and family therapist David McMillan, our life strategist this evening, Meredith L. Stewart, who is an acupuncturist and Chinese herbalist. She's at Acupuncture Shreveport, and that's on Olive Street, corner of Olive and Line.
That's right.
And in Suite 212, 745 Olive Street in Shreveport. Look, go to ShreveportAcupuncture.com, and you can find a whole lot more about Acupuncture Shreveport, and I hope you will. Mentioned going in to break, Ruben turned Carla's microphone off so she wouldn't attack me, but mentioned hormones and neurochemistry, neurochemicals in the brain, and that's one of the things that acupuncture does is it affects the hormones, the neurotransmitters, and it stimulates them, right?
Absolutely. That's all part of that improving communication through the body. All the hormones systems, you know, we have the pituitary in the brain, we have thyroid in our throat, we
Right.
have our adrenal glands and our, sexual glands.
Right.
And all those hormones interplay with each other. So improving the communication through deep relaxation of the fascia, as I mentioned, or in acupuncture we call them the channels or meridians. I think that's what really plays into the body being able to bring itself back to balance. So we do have success with problems with those areas.
So there's a lot of people, probably a lot of people listening to us this evening that are in chronic pain. Maybe some go, get traditional chronic pain treatment. A lot of people say, I don't like that. I don't want that. So acupuncture addresses pain.
Yes, sir.
How so?
I want to tell about a very interesting technique when you mention chronic pain.
Okay.
That I've it's more recently developed. Okay, my favorite teacher is a lady from Japan named Kiko Matsumoto, and that's who I follow her for continuing education as much as possible.
Okay.
She is just awesome, and she learned, and this is new knowledge in the medical field. MRI has shown us an area of the brain right in the front on the left side, and where there's chronic pain, that area of the brain has shrunk. And it's associated with the pain. So if something happens that makes the pain go away, that part of the brain returns to normal size.
Right.
So Miss Kiko said, I think I can affect that. And she started putting 4 needles on the scalp above this area of the brain and having awesome results with chronic pain.
Wow.
And now I've had an opportunity to explore this in my clinic.
All right. So what have you seen? Have you got some stories here that that you might be able to tell us about people who have come to you with chronic pain problems? Maybe they've been to the traditional route.
I want to be clear. This is not going to be the answer for everyone, but
Right.
I want to share some dramatic.
We're talking
cases we've
alternative
had.
this evening. Yeah, we're talking alternative treatments this evening, right?
Yeah, well,
Yeah.
alternative to pain medicine and
Right.
and surgery. It
Right.
is.
Yeah.
I have a dear patient who was in a bad car wreck 30 years ago and had pain all over her body. Everything hurt, all her joints, everything. And we started using these 4 needles on her scalp. The pain is gone. After 30 years.
All right. So she's lived with the pain for 30 years. How many treatments did you do with her? About.
Let's say 3 or 4 with these on the scalp, and then she
I was
found.
expecting you to say like 20 or
Yeah,
30.
right.
No, sir.
10 or
She
12.
found this was the answer for her because her body had healed, but her brain was still telling her there was pain. So it wasn't. We weren't having to go in and heal her whole body. That had already happened.
Right.
But the brain never
But
stopped
the
sending the
brain
signal.
the brain didn't know that.
Exactly.
Yeah.
It continued. If the brain says there's pain, period. You can't tell the difference.
Well, that makes sense. We've done, since we've been back on the air, we've done a lot of different programs and different life strategists. And one of the things that I think emerges when we're looking at the brain is 2 things that stand out for me, maybe more for you, Carla, but the neuroplasticity.
Yes.
That the brain is not fixed, but it can heal. And the
It's
other thing
ever
that
changing.
yeah, ever changing, and the other thing that stands out for me is the patterns of the brain. The brain gets into its, and I'm hearing you say this with this lady. The body had healed, but the brain kept giving. It was in a pattern, and until you break that pattern, the brain kept sending the same signals. So
she found after those 3 or 4 treatments, if she would get a little twinge of pain, she could massage herself on those points. I taught her how to find those acupuncture
wow.
points, and you kind of massage them with your fingernails. And putting the needle there is a much stronger stimulation than the massage, but there is some effect from what we call acupressure.
I'm going to ask you, Meredith, because if we were taking calls from our listeners, we would probably get a call asking, because you mentioned, okay, that we call them quote unquote needles, right? But they're hair thin. They're very thin.
That's right. Most of our experience with needles is the hollow.
Yeah.
We get a shot, and
Yeah.
that is relatively. It has to have a hole in the middle of it.
Right.
It's so much.
Let some medicine go through into our bloodstream or into our muscle tissue.
Right. Or we stick ourselves in our fingertip, and that
Right.
hurts.
Right. But I bet we'd get a phone call that said, well, is this safe? You're going to put needles in me. Is it safe to do that?
They're sterile. They're one-time use. Sterile stainless steel needles. I use, the best needles I can find, which come from Japan, and they're one-time use. You open them. You never reuse a needle, even on the same patient. So I'm not going to, take it out of the leg and put it in the arm. It's once it's used, then it's disposed.
All right. Now, your wonderful patient, she wasn't feeling pain in her head, in the front part of her head. She was feeling pain in other parts of her body, and yet, again, you know to treat the front part of the brain, and so oftentimes are patients confused by that? Well, wait a minute, you're not putting the needles where I hurt.
Absolutely. They're expecting that's where the needles will go, right where the pain is, and that's the difference between acupuncture and dry needling. Dry needling uses the same type of needles. This is becoming more and more popular in physical therapy. They put the needles in the painful spots, and that's one type of treatment. There's just so many different styles of acupuncture, and acupuncture has a lot of theory behind it. That if I'm going to put a needle in your hand to numb your jaw, for example. So that's the difference in acupuncture and dry needling.
So with the story with your lady, and I bet you're going to tell us some other stories too, but the story with your lady, is it like, well, the brain rather, not the body, but the brain had discounted the switch in a way? So, the switch wasn't on for pain anymore, but the light never went off.
I'm afraid I can't answer that completely.
Yeah, I don't know if I'm asking that right.
This is not really traditional Chinese medicine. This is based on, modern understanding and MRI.
Right.
But I will say this: the lady who originated this particular treatment has noticed it's especially common in people who had a concussion in childhood. Concussion in childhood leading to chronic pain. Having an injury not heal later in life.
Right. Wow.
That's so super cool to me.
It is cool. The whole thing is cool.
Everything with the brain. Well, I mean, think about it. People who have a limb removed have phantom pain.
Yeah.
I mean, that's all in the brain.
Yeah.
I mean, so we know that the brain has the ability to like you said, if the brain says there's pain, then there's pain, whether my leg is there or not, right?
Absolutely.
I mean, it makes sense.
I have one more comment about that. These 4 points I'm talking about on the top of the head.
Right.
We can test immediately. We can. You come in, you lay on the table, and you say my back hurts. It's been hurting for 2 years. Even if it's kind of off and on, the same area is not healing. Can press firmly on those 4 points and wait. Have the patient relax. Take a few deep breaths. Give it 30 seconds or so, and see if you can immediately tell a difference in the pain. If so, I use those points. If
Wow.
not, then
Yeah.
I go on to
Then you go on to test other, and there's a diagnostic process that comes into play, right?
Yes,
When if I come in and I say I've got back pain or whatever, I've got migraine headaches, how will you go about figuring out where those whatever might be ailing me originates?
There's a lot of reflex zones known on the body. Um, for back pain, I often will press on every level of the spine because you're feeling the pain in your low back, but you don't realize it's really sore in the upper back when you press between the vertebrae. So I want to get a sense of what's going on through the whole spine, and then whatever that spinal level is, there are particular acupuncture points associated with it. So if you have pain at L3, L4, there's a certain spot below your knee, and that releases that, and it's related internally through the connective tissue. For L5 pain, most common spot is on the inside of the elbow, and I'm looking for an immediate result. So may not go away completely with one needle, but I want to keep putting needles till it's down by at least 50% of what it started the first time I pressed, and then we know we've got blood flowing through there. Does that make sense?
Makes total sense. Yeah.
Once I have an acupuncture treatment, or once I finish my regime, and let's say my back pain is gone, is this something that I have to keep coming back to, or is it healed?
The answer to that is it depends on the cause. So, say there was a trauma, the car wreck, and the pain is healed, that's not going to come back. If the pain is due to your posture, and and you continue that same posture, you don't make a change, we don't identify what's caused this in the first place, then we can expect it to come back. If the cause is not removed, we can continue to experience the same problems over time.
For those of you who missed it on the camera, as soon as she said the word posture, Carla started straightening up.
I sat up straight.
I love it.
Hi, Mom.
The things you miss when you listen on the radio.
I love it. only on this program with our ace producer, right? The World Health Organization actually lists many conditions that acupuncture is considered an efficacious form of treatment to consider. And there have been clinical trials done. Again, we're talking the World Health Organization here, so different from our, any AMA or national, testing. But we're talking the world here. In fact, they go on to list, I think it's about 90 conditions for which acupuncture is likely to be effective.
I think that's so wonderful. Think about worldwide how inexpensive this form of medicine can be, how portable. If people just are educated in it, it's something you could do anywhere, anytime, any place, inexpensively.
I guess I didn't realize that acupuncture could help with, you get the whole skeletal thing, you get the whole neurological thing, but the things like when you talked about the liver or some of those kinds of things, that I had no idea. That kind of makes my mind blow a little bit.
You want to get a hold of Meredith? Well, the way you do that is you can go ShreveportAcupuncture.com. You can call her. We'll give her phone number when we come back.
Your door is always open and your path is free to walk. That makes me tend to leave my sleeping bag rolled up and stacked.
Welcome back. Welcome back into 101.7 FM and 710 KEEL. Welcome back into Strategies for Living. PLPC Carla McCormick, marriage and family therapist David McMillan, our life strategist this evening, Meredith Stewart, who is acupuncturist, Chinese herbalist at Acupuncture Shreveport at 745 Olive Street. And you can give her a call, 459-9125. If you forget that number, ShreveportAcupuncture.com. And go visit her. Lots of information. Good site. Lots of information on the site. So you can continue the conversation with Meredith. I got to know, am I gonna break the bank here, Meredith, if I come to see you and okay, well, I have psoriasis. I call it my stress barometer, right?
Uh-huh.
So it's I've lived with it all my life. It comes and goes. It's like I can tell by the redness. And I got a brother-in-law who's a dermatologist.
Mm-hmm.
So I've got every known cream to
make,
man. Yeah. And, that, to be fair, some of it, calms it down for a while, but it's never gone away. I'm listening to you this evening, and I'm wondering, could you make it go away?
Well, okay, I can answer that
Yeah.
specific condition. What I would recommend, first of all, from Chinese medicine perspective, they didn't have a concept of autoimmunity, which that's what psoriasis is, where your immune system is attacking your skin.
That makes sense.
So from the traditional Chinese medicine perspective, it's heat. They call it too much heat in your blood. A lot of the diagnoses sound like weather reports on your body. So
See, Carla, I'm hot.
too
She's
much
telling me I'm hot-blooded. See?
cold or
Yeah.
heat.
Oh gosh, I'm not gonna be able to live with them.
Okay, so it bubbles up through your skin and it's redness, and you see that stress barometer. As you get
Wow.
more stressed, more heat builds up inside, and your body lets
Can
it
you
out.
make
That's
this?
how they
Can
see
you
it.
make it better?
Yes. The way I was taught, we don't say we can cure autoimmune disease, but we can make it go into remission.
Ooh, I like that. Okay, now, is this going to be an expensive proposition for me?
Let me tell you how we do that basically. So for acupuncture itself, we have just a flat rate. Sometimes we do additional therapies during the visit, or we do 1, 2, or 3 sets of needles. It's just a flat rate for the visit. So we
Right.
charge $105 for the first visit, and any visits after that are $75.
That doesn't sound bad.
And then we have herbs, which are sold separately. So I really try to give people the least amount that is going to really help them. If I think herbs are more beneficial for your condition, I'll say, we can do a couple of acupuncture sessions, but I really think these herbs are what is going to heal you.
Right.
Depends on the condition.
Right.
Some things acupuncture is better for, something herbs are better for.
Mm-hmm.
And
probably sometime in the combo, right? Yeah.
So for psoriasis specifically, I have a really nice topical ointment that I have to convince people sometimes, because they've had it all their lives and they're saying, I've tried everything. And
Yeah.
could you just try this one more? They're really pleased with it. The Chinese herbs are so effective. And then I have an internal herbal formula also for psoriasis.
Okay.
And then, according to modern understanding, my understanding is that healing the gut is so important. Healing the lining of the gut is so important where there's
Okay.
autoimmune disease.
Mm-hmm.
I think the body doesn't just go crazy for no reason. I think it is trying to protect you ultimately, and that undigested proteins leaking through the gut into the bloodstream cause the immune system to need to clean up that food, and then that protein looks like a protein is part of your body, so the skin is an innocent bystander, where your body's really doing the right thing, that it has to clean up this milk, for example. I see a lot of psoriasis associated with dairy allergy. So I would recommend for you a really nice probiotic that can live through your stomach and get into your gut and live in there and heal the lining.
When I come for my treatment, how am I going to feel afterwards? Am I going to have to get Carla to come pick me up and Ruben to come help her because I'm going to be so out of it? What will I feel like after my treatment?
Most people will drive themselves and drive out of there. It does vary. So often people are really relaxed. They fall asleep during the treatment, and so it just takes them a minute to wake up. We have some peppermints and some tea out there. If people are really kind of out of it, I encourage them to sit for a little while before they go drive.
I've heard that about her office, guys. That when you
put you to
walk
sleep?
into, well, no, that when you walk into it, there's a. How did this person describe it to me? That was like you felt the healing, even when you walked in. The energy of the healing is the way this person put it.
Thank you so much. That's
You're welcome.
nice to hear.
Yeah. You must be doing something through the years that, because I've heard that multiple times before I picked up the phone. I can't even tell you how many times through the years I've heard about Meredith Stewart. Never heard anything except positive things.
Meredith, can you do acupuncture on kids?
Yes, and we've done it on little babies. Okay, little babies is very interesting. We use, of course, the smallest of needles, and you just insert them and then remove them immediately, so they don't have to lay there with the needles in. We say their chi, their energy, moves so quickly that just the insertion and removal for them is the same as an adult lying there for 20 or 30 minutes with the needles in place.
What would you use acupuncture on a baby for?
Poor digestion, colic. I'll tell you, it's it hasn't been real common for people to bring babies in because they just don't know.
Right.
But the small ones that I've seen, the infants and up to about 2 years old, you can tell they really like the acupuncture. Okay, then they get scared of it. So then from, say, 2 or 3 years old to maybe 8 years old, I really would not. I can't stand to work on somebody who is scared and doesn't want to do that. So someone below the age of 2, I had the cutest little boy that would come in. I'd put a needle in, and he'd say, more. He loved it. He loved the way it made him feel. So it didn't hurt him, and until he got scared, it was fine.
I'm sorry, go ahead.
Can you use acupuncture for like increased energy and David and I deal with a lot of mood disorders, so mood stabilization and that kind of thing?
Yes, ma'am. It's just a matter of getting a diagnosis of what causes it. So in traditional Chinese medicine, the way they diagnose has a lot to do with looking at your tongue. The tongue is a pure muscle that we can see, so looking at the color, the size, the shape, the coating of the tongue, they've correlated that with all different kinds of imbalances internally, and also feeling the pulse. So we feel the pulse on 3 positions on each wrist, and it's subtle, but it's very interesting. We're not just counting the pulse and the heart rate. We're feeling, is the pulse in this position deep or floating? Does it feel like a smooth flowing stream or like a choppy sea in here? Okay, so those are some traditional ways of diagnosing. Other styles of acupuncture use a lot of pressing, like I was talking about, pressing all over the spine or pressing on the abdomen, particular reflex points. So if I press below your belly button at a certain angle and it's sore, that can be related to adrenal problems. And we could say more about that, but I have one more modern diagnosis tool, which is called an acugraph, and so that's a modern design piece of equipment and software that you touch a little wet Q-tip to certain points on the body, and it reads the electrical conductivity there. You have to hold a metal bar in one hand.
So no pain at all.
There's no pain there.
No shock, no nothing like that.
Correct.
Yeah.
But you just get a graph of where there's high energy, where there's low energy in the body.
This is absolutely fascinating. I mean,
it makes me wonder why we don't know more about this.
Because we don't have more conversations with folks like Meredith, and we need to.
Yeah, we do.
We're going to have more. We're going to have to promise to come back again and again.
I'm having fun. Thank you.
We'll be back with remaining moments with acupuncturist, Chinese herbalist Meredith Stewart today from Acupuncture Shreveport here on Strategies. Be right back.
Yeah, my bucket's got a hole.
just learning stuff. Learning stuff.
This is my favorite thing about this show, that I get to meet interesting people and learn so much.
And welcome back, folks. Carla McCormick is talking about the show Strategies for Living here on 101.7 FM and 710 KEEL. And I'm marriage and family therapist David McMillan, and she's talking about our life strategist, who is acupuncturist and Chinese herbalist Meredith L. Stewart. And the practice is Acupuncture Shreveport. You can find her online, shreveportacupuncture.com. And wow, we've cut you. You've got to promise to come back and share more. I could go on for another couple of hours and ask you questions.
Well, I'd be happy to.
So we'll definitely have you back. I got to ask one last question, though, and that is because so many, and Carla, I bet you too, so many of our clients get their sleep compromised. And, sleep is so important in healing body, mind, or spirit. Can acupuncture help sleep?
Yes, sir. First of all, just basically, no matter what we work on with acupuncture, people tend to say they sleep really well afterwards. So that is part of, just getting their nervous system relaxed.
Part of the deal.
But for major, serious insomnia, serious sleep problems, you need to get a diagnosis according to Chinese medicine. So one real common thing is the too much heat in the body idea, that the brain is too hot. And there are acupuncture points, there are herbs that can help cool that down. Poor blood flow to the brain. One common one is, needing to help the blood flow through the neck, through the back of the neck to get to the brain, to
make you comfortable,
sleep.
Make your body comfortable to be able to sleep. Wow. Okay, if you would like more information, folks, pick up the phone and call Acupuncture Shreveport, 459-9125, and you can find out much more at shreveportacupuncture.com. Meredith Stewart, thank you so much for your time this evening. I know you've worked a busy day all day long helping folks, so thank you for taking time to educate us this evening here on Strategies.
I really appreciate the
It's super
opportunity.
nice to
I
meet
wish
you.
people, more people knew more about it, because I see.
We'll have you back.
Hopefully we can help.
You bet.
All right. Thank you.
Carla, you've done it again.
Meredith did it.
Yeah. Ruben, you've done it again.
I'm afraid, yes, I have done it again. Yes.
He's a radio guy. He will always take credit, where credit is
Every time.
due or not.
We don't get enough.
Yeah. I love it. It never changes. It just never changes. Folks, thank you for tuning in to Strategies for Living. We've been presented by CADA, the Council on Alcoholism and Drug Abuse of Northwest Louisiana, by Milestones Counseling Center, by Jerry Anderson, State Farm Insurance, by Learning RX, by Highland Place Rehab and Nursing Center, by Resilient House, and by Jacob's Well, inspirational books and gifts. If today were the last day of your life, you only had one more phone call that you could make, who would you call? What would you say? And why are you waiting? Make the call. For Meredith Stewart, for PLPC Carla McCormick, and for Ruben Wright, I'm marriage and family therapist David McMillan. And we'll see you back here next time on Strategies for Living.